Let's start with ventricular fibrillation. What is ventricular fibrillation or V-fib? Is an abnormal heart rhythm in which ventricles of heart move quickly and randomly. And the ventricles are lower chambers of your heart that pump blood to the body. Here in this condition, ventricles tremble or shake or twitch instead of expanding and squeezing. Then what happened? They can't pump blood as they should. It is due to disorganized electrical activity. In normal heart rhythm, electrical signals travels from SA node in atrium to AV node in ventricle. AV node serves as a electrical gateway to the ventricles. VF happens when the abnormal electrical signal starting in the lower chamber of heart makes ventricle to quiver or fibrillate. Do you know? VF is the most common deadly arrhythmia, results in cardiac arrest with the loss of consciousness and no pulse, so this condition needs immediate medical care. Let's see causes of VF. The most common cause is heart attack or ischemia. Then congenital heart defects, which means heart problems present at birth. Heart surgery, certain medications, certain types of drug usage, electrolyte imbalances, mainly in potassium and magnesium, are also causes of VF. Coronary artery diseases, long QT syndrome, which means it is a condition affecting repolarization of the heart after a heartbeat. Then heart failure, environmental factors like electric shock, drowning, then comatose cordis, which means a rare disruption of heart rhythm that occurs as a result of blow to the area directly over the heart also leads to VF. What are the signs and symptoms? Just before V-fib, you may have symptoms like chest pain, that is angina, dizziness or lightheadedness, nausea, rising or erratic pulse, heart palpitation, shortness of breath, which means is an uncomfortable feeling of not being able to breathe well enough. Someone who has this condition will collapse with little or no warning and won't respond or react when you try to wake them. They will also gasp for breath or stop breathing. Next, diagnostic measures of VF. It involves physical examination and medical history collection. Then blood tests to check for protein that leak into blood when the heart is damaged by heart attack. These diagnostic measures are very similar to diagnostic measures of atrial fibrillation. Next is ECG. The quick and painless test measures the electrical activity of the heart. Let's see ECG findings in VF. Rhythm and rate are chaotic. Chaotic means it's a state of disorder or confusion. And what about ECG waves? Here, as I said before, heart is tremble or shake due to abnormal firing of electrical signals from multiple sides. This leads to fibrillatory waves in ECG with varying amplitude and shape. And there is no identifiable P waves, QRX complex or T waves, and heart rate anywhere between 150 to 500 beats per minute. And other diagnostic measures include echocardiogram, chest X-ray, cardiac CT, cardiac MRI, and coronary angiogram with cardiac catheterization. What are the types of V-fib? Depending on how the heart's electrical activity appears on EKG, doctor may diagnose coarse or fine ventricular fibrillation. Here in this ECG, you can see coarse VF appears as larger waves compared with the waves relating to fine VF. Do you know, the fine VF has a more negative outlook because it indicates a worsened state. Coarse VF also can progress to fine VF if it continues for a prolonged period. Let's see about treatment. This is a most dangerous arrhythmia and life-threatening medical condition. If you are seeing a person collapsed with cardiac arrest as a result of VF, the treatment starts with calling your local emergency number. Then begin CPR if the person is in unconscious and no pulse. And I hope all of you know about CPR, which basically includes chest compression and rescue breath. The next step of CPR is defibrillation. Always remember, this is a shockable arrhythmia. Here, an electric shock that is delivered to your chest wall to restore normal rhythm. If a person is collapsed out of healthcare settings, you can use AED, that is automated external defibrillator. Whereas if it is in hospital settings, advanced defibrillators are using to deliver a shock. Injection epinephrine is the first drug given and may be repeated every 3 to 5 minutes. If injection epinephrine is not effective, the next medication in the algorithm is injection amiodarone 300 mg. Injection lidocaine also recommended as an alternative to injection amiodarone. Defibrillation and medication are given in an alternative manner between cycles of 2 minutes of high-quality CPR and stopping medications that causes VF and correct electrolyte imbalances. Next one is ICD, implantable cardioverter defibrillator. Most people who survive ventricular fibrillation will need a provider to place any implantable cardioverter defibrillator. This device can detect arrhythmias and deliver an electric shock to restore your heart to a normal rhythm. Catheter ablation. A catheter is inserted into the heart. It uses small burns or freezes heart cells to cause some scarring on the inside of the heart. These help break up or insulate the electrical signals that cause irregular heartbeats. Left cardiac sympathetic denervation. This is an alternative therapy for individuals diagnosed with a long QT syndrome. It refers to interrupting the sympathetic input to the heart by removing or blocking the extrinsic sympathetic nerves. Next comes complications of V-fib. Of course, it is a most dangerous arrhythmia. So it includes sudden cardiac arrest and death, coma, brain damage, heart muscle damage, kidney failure, and liver failure. Hope you understood the topic. If you want more videos, please like, share, and subscribe my channel. Thanks for watching.